So what is going on in Florida in your line of work in your
So I would honestly say nothing. Well, I would say 2 weeks ago there was some developments, but other than that, there hasn't been much change. I realized how big of an impact news is. So not just like the news, like as a corporation, as an institution, as we're looking at Fox, MSNBC, CNN, that kind of stuff. I mean, obviously that stuff impacts you. Um, but the news of this Delta variant um, and kind of the effects of it in 2 weeks ago was interesting, to say the least. I would say that all my clients, if I could term it a relapse, they all relapsed into at least a minimum their stress or their anxiety. It was a hard week about 2 weeks ago, um, where everyone just had to kind of take a pause. Um, but after that, it's been business as usual. Um, nothing different um, than what I would normally see.
so what you're saying is all of your all of your EMDR clients, because you only do EMDR, and with all of the bombardment of information coming in, they had a period of regression.
Yeah.
And what did you do?
So normally what happens is when they come into a session, my first question is any insights, developments, or thoughts on the previous session or since we've met. And normally that takes about 5 minutes. Well, with that week,
I'll ask the question, and what have you learned since we last met? So,
right. And so normally that takes 5 minutes and then we move on. But 2 weeks ago, if I asked that question, we would spend the whole session on whatever the statements were. And so most of the time they just, in that moment, they just needed to speak, just to talk.
Okay.
Just talk through everything. Because if you remember when you first encounter trauma, the best thing you can do is to get somebody to talk or to work through it. And then the body naturally works through it just fine, right? Most of the time. And so such is the case for these individuals as well. Even individuals who have experienced trauma and are struggling to get past what happened to them. When new trauma comes in or new events that are hard to process, if we can process it straight away, we can move past it really quickly. So, so it was interesting to see that. Because then we could go. Then we were back onto our treatment plan or to whatever we were working on the week after. So I do get a lot of doctors, a lot of nurses, and strangely, and a lot of lawyers right now.
Interesting. That's
I think I've mentioned that I tend to get a lawyer here and there. I've never realized. Um, I mean, being a lawyer would be stressful, I guess, but
yeah. I mean, what's in anything? Any insights as to what's going on in the legal field that it is increasing the stress level of attorneys without releasing too much information?
I would say that just in any profession that's been impacted COVID, the legal field has been impacted as well. In how legal disputes are settled and how how people meet, and the courtroom looks different.
It does.
So a lot of things are done via telehealth. A lot of things are done differently in the courtrooms, a lot of different procedures. And, when you go to law school, you're taught procedure. And
And
law
your
school
scheduling just has to,
didn't teach you COVID procedure.
right, scheduling has to shift a lot.
Yeah. And so, there's lawyers that use that to their advantage, and there's lawyers that are struggling to use it. It's a game, right? And as well, for some lawyers, it's a part of a new game for them.
A new game of chess.
Yeah. Yeah.
Hmm.
So, that's interesting. But I tell you what it is, tell you the hardest are the doctors and the nurses.
Oh,
So
yeah.
I'm curious to see what happens in a few months.
In what way?
Well, I would be surprised if there isn't I mean, there already is a short change of staff right now, a shortage. But I would imagine that there's going to be a big shortage in that field.
Do you foresee a lot of people quitting?
Oh yeah.
Okay, that's what I've had that feeling that. Well, and there's been indicators in that direction that a lot of the doctors and nurses are just totally getting.
And you can see that in the bonuses that are also being offered, right? So like these exuberant bonuses are being offered by hospitals and healthcare agencies and even school bus drivers. And I laugh about that because I've never seen billboards for school bus drivers before, and it's new to me. So I see a lot of school bus drivers needed signs with these bonuses. Now I saw the other day, which was really surprising. I still stay connected in the wilderness field, and I was seeing some bonuses in the wilderness therapy field, and I was really amazed at those short-term bonuses that were being offered, because that's usually a hard job to get, some of those jobs.
Well, I was going to ask you, what did you see in the world of therapists, or what? Excuse me. Or what are you seeing? In the world of therapists.
The private practices are thriving.
Yes.
I don't know what community mental health looks like right now. I mean, I assume they have a lot of clients, because private practice has a lot of clients. But the reason private practice is thriving is because we get to decide. We get to have a cutoff point. Most of the time we're our administrator, and we're the boots on the ground at the same time. So we get to decide. With community health, you don't get to decide. You've got, if you're boots on the ground, you've got no skin in the game. In terms of how many clients you see, the cases you can take on, the amount of work you take on, you don't get to make that decision. So
I remember how tired you would get doing school social work, and the number of clients you were seeing just back to back to back to back, and it's like, oh, I don't know how long this can last.
Yeah. So I don't know. I imagine that that's pretty chaotic.